Hey everyone, welcome to this month's question of the month. I'm David Keil. As you know, I'll answer your question if you go to yoganatomy.com/my question. All right, this month's question comes from Alli. I have seen videos on inner knee pain in Lotus that you have out, but I have outer knee pain in Lotus. I also feel the same pain when I'm trying to keep my legs together and parallel in dhanurasana and poses like that. I have a torn hip labrum in one of my knees and can probably assume both. You can't have a torn hip labrum in your knee. So you either have a torn hip labrum, sounds like maybe you have a meniscus tear. What do you recommend I do to help heal this and prevent further pain? I'm sick of modifying. I assume this to be IT band related. Am I correct? Is there something I should be focusing on more in my practice? I value what you're doing. Appreciate it. Sure. So a couple things. Whether you have a torn hip labrum or a torn meniscus, cartilage has a hard time repairing itself. Small tears, let's say it's the meniscus, they won't necessarily heal, but they'll sort themselves out. You can live with them, okay? Depending on where they're located. The further out on the edge of the meniscus, the more blood supply they keep, so they're more likely to heal. The further in they are towards the center, the less likely they are to repair themselves. So, a lot of times, and you mentioned IT band, I find that outer knee pain does have something to do with tight IT band. And what I would do, if you haven't been to one of my workshops, come to one of my workshops. We do this test. Whenever somebody presents pain on the outside of their knee when they're doing Lotus, I straighten their leg. I manipulate with my thumb their IT band. The purpose of that is to reduce the amount of tension in it temporarily. And then we have them try their Lotus again. And if the pain in their Lotus has gone down, chances are we need to generally reduce the amount of tension and pressure in their IT band. How do we do that? Well, there's usually a few culprits, not always, okay? Other activities such as running, cycling, or people who were dancers do often have tighter IT bands. And dancers, it usually comes from making adjustments in yoga that are not appropriate for their body. So dancers typically have more of a turnout. And so a lot of people are instructed to keep the outer edges of their feet together or be more pigeon-toed in general. And this increases the amount of tension in a muscle called the tensor fascia lata, which is on the top front of the hip. Tensor fascia lata, the tensor of the lateral fascia. The other name for the lateral fascia is the iliotibial band. When that happens, I don't know exactly what the mechanism is, but it's doing something at the knee. It could be how it's attaching at the knee. It might be actually grabbing onto the meniscus a little bit because the hamstrings attach slightly onto meniscus fibers as well to help move it during certain types of movement. So maybe this is the issue. So if you fit any of those categories, focus on easing off and releasing your iliotibial band. How would this play into your dhanurasana? I assume Ardhva dhanurasana. A lot of times what happens is, maybe you're a dancer. Let's assume you're a dancer for that, or you're not. Your knees naturally want to be out in your back bend based on what you said. When you try to keep them parallel, you have more pain. Make sure you're doing that action from your hips and not just from your feet. I've seen this a few times where people are told to put their feet parallel to one another and their knees are out and they rotate their feet. This creates an internal rotation at the knee joint itself, creating pressure on the outside of the knee. So keep an eye on that. And the bigger picture here, the most important thing, and I stress this in my workshops over and over again, when you're dealing with knee pain in particular, let's say, you have to look at the whole chain of joints. That means foot, ankle, knee in the center, and hip is the primary one. You want to make your adjustments based on the primary joint first. Your knee alignment should track straight forward. So if you think this might be you, Alli, sit with your legs straight, look at your kneecaps, and wait until your kneecaps are straight. Forget about what your feet are doing. When your knees are straight, that is your alignment. See if that helps. All right? Anyway, anybody else, you got a question, specific or general? yoganatomy.com/my question.